All right, let's get this started. So I want to say welcome everybody. This is going to be a webinar where we're going to talk a little bit about just how to take care of ourselves during the pandemic, because it's brought up lots of change, lots of stuff going on, and it's really important that we're looking after ourselves. So I'm Jen. I am the program leader of the LifeStreams program at Garth Homer, and kind of the face behind the LifeStreams online website. And today I've got my friend Tanya joining us, who is an awesome gal, huge self-advocate, and we're going to chat a little bit about mental health. So how are you doing, Tanya?
I'm doing good, Jen. How are you?
Yeah, good. Do you want to introduce yourself to everybody?
My name is Tanya, and I participate with LifeStreams, and I'm in a program called Options, which I'm not going to right now because of the pandemic.
Mm-hmm.
But I would usually go there 5 days a week.
Yeah, it's hard. That's a big change, eh? Having to stay home from program.
Yeah, it's a bit of a change.
Yeah, those changes, man, they're tricky. So Tanya, I want to bring in somebody else to this conversation because I think they'll be super helpful in kind of talking about some of these feelings that have come up fast. And let's bring on Dr. Comeau. So Dr. Comeau is a psychiatrist based out of Victoria, BC. He's a great guy, and we actually go back. We went to school together way back in the day, and it's so awesome to have connected again with you, Kent, and to be able to bring you into this like super important conversation. So welcome.
Thanks for that, Ed. Yeah. Thank you for inviting me for this talk. I'm very excited for it. Like Jen said, I'm a psychiatrist in Victoria, and I work at the anxiety clinic at Victoria Mental Health, which is close to the Royal Jubilee Hospital. And I also work at the anxiety clinic and the Foundry Clinic, and I see 17 to 24-year-olds there.
Awesome.
Yeah.
Awesome. So really what I think is so important for us to kind of address right now is just the way the pandemic's been affecting everybody, you know, beyond obviously like the physical sickness that some people are having, but like it's bringing up so many emotions for people. There's been huge changes, and life has been feeling really different. And I know that's something that, you know, it's been affecting me. And I think it's touching kind of everybody right now. So how have you been feeling with the pandemic? Tanya, how have you been making out?
I've been pretty good.
Yeah.
Yep.
Mm-hmm. There are big changes. Like, did it take a little while to adjust to some of that?
Oh, yeah. Yeah.
Yeah, for sure. And I know, like, when I connect with my friends, like, people are feeling it, right? Like, I think people are feeling more tired. Like, is that?
Oh, yeah.
Sometimes I'm just exhausted, and I don't know if that's just like from like, you know, trying to keep up with all the new news, or, you know, that like Zoom conversations, as nice as it is to connect with you like this, but like they get tiring, and like there's just so many things going on. Have you been seeing that people are kind of more tired these days, Kent? Is that?
Oh yeah. I mean, I do. Like sometimes it's, you know, things are just harder. You know, like simple things that, you know, there's more barriers. You got to wear a mask. You can't go certain places. You can connect.
You can't travel.
Mm-hmm.
Can't travel. Yeah, exactly. Like things that we used to take for granted. Things are just hard, and sometimes that just kind of makes it's a bit demoralizing, and it's amotivating.
Mm-hmm.
Yeah. So I've felt it, and I've also seen that, you know, a lot of people that, you know, I've been working with, or even friends, they're also feeling that too.
Mm-hmm.
Yeah.
Totally. And I think that's so important to remember that like we're not alone in those feelings. You know, it's, you know, so many people are feeling these things, and it's okay to kind of like acknowledge that that's going on for us. And then, yeah, and then, you know, make sure that we can connect with each other. So that's another huge thing, right, Kent? Like strategies around, you know, kind of how to approach this, you know?
Yeah, well, like, because there's just new challenges, right? And we kind of have to rethink how we do things. And, you know, if it's simple things like connecting with other people, which is really important, we just have to think of new ways of doing that so that we meet that need, which is really important to feel connected. And just even basic stuff like, you know, self-care and making sure you're getting enough sleep, and even, you know, eating properly can be, you know, it's tough to do, but just, you know, basic stuff, making sure you're drinking enough water, eating well, getting sleep. And then the exercise component too, I think, you know, that's become, you know, a lot harder to do. But even just simple things like going out for a walk, they even say going out 3 times a week for about 30 minutes. And it doesn't have to be like a workout where you get your gym gear on, you know, it's hard at this time of year because it gets cold, but just to get your heart rate up a little bit can really help and benefit and really help the mood, and getting out in nature can also help. Yeah.
That's such a big one, hey? It's so, I know, you know, when I get out, I feel so much better, but sometimes it's so hard to motivate myself to get out. Yeah. What do you feel about that, Tanya? Have you?
I was the same, like in the beginning, like I just felt so, I guess the word's depressed.
Yeah.
Like I just wanted to stay in, and I didn't want to be around anybody. And I was just feeling really sad all the time. And then my program decided to do Zoom, and that just made me feel better.
Amazing. So just having that connection back, right?
Yeah.
Awesome.
It's good to feel those feelings, right? When they come
and getting my iPad really helped too, because now I can FaceTime people.
Yeah, for sure. So that, you mean, technology right now, I mean, it's such a big support in helping us to stay connected. And, you know, I guess not everybody has access to an iPad, but even just, you know, making sure like we're setting up phone calls and check-ins with each other, you know, even if it's an old school, like on the wall phone, I don't know if anybody still has those, but like, dial up, but just making sure that we can still, you know, chat with people. And, you know, I know we're all doing our best to keep each other safe, and so staying at home, but that, you know, that loneliness can totally get to you.
Yeah.
Like, so I think, you know, it's good for us to, you know, remember that we need to schedule those kinds of things into our life, like those calls, the Zoom chats, to keep ourselves feeling connected, but also to remember to reach out to our friends, so that, you know, that, because they might be feeling lonely too, you know.
And yeah, and I was gonna say, I mean, Tanya, I think you're such a social person. It was probably really hard to not be able to socialize the way you used to.
Yeah.
But I do know a lot of people who really have enjoyed the pandemic because now they have permission to stay at home and to, you know, just be at home, which sometimes it's driven by anxiety. Like maybe they had social anxiety and now they're given permission to stay at home. And what we know is that if you avoid and get in too much of a comfort zone, if you have anxiety, it could actually get worse.
Right.
So I think I just want to put that plug in, that it's important to be aware of that. Because once this pandemic's over, you know, life is going to go back. And if you have anxiety and you haven't been out for a while or socializing, it could even be harder. So that other important part, getting out of your comfort zone a little bit, and staying safe though, not out of your
Yeah.
comfort, exposing yourself to.
Mhm.
Of course, there's some that, but yeah.
For sure. I feel that kind of made me remember another thing too, and that's, I remember when the pandemic first hit, there was lots of people talking about like, oh, like this is a great opportunity now to like, you know, live your best life and accomplish all these goals that you didn't have time for before and do all this. And then, you know, when, and you know, maybe we set out with these great intentions, but then, you know, these feelings of depression or loneliness all come in, and we ended up not being motivated to do those things. And then you also feel a little bit of guilt about not, you know, then not accomplishing things. And I think it's so important to be gentle on yourself and acknowledge, like, you don't need to be pushing yourself to go out and accomplish all these great things. You know, if it's okay to just be where you're at, you know. And it's,
I think like on those lines, Jen, I think that's true. I think the pandemic it's giving us an opportunity to rethink how we do things and live our lives and simplify our lives, and get back to kind of the basics. It could be an opportunity for self-reflection and growth, and to reconnect with things you used to enjoy if you have a little bit more time, right? Yeah, I see it as an opportunity as well. I mean, the pandemic is a horrible thing, but in that, there's things that maybe we can do and see opportunities in it as well. Yeah.
Yeah, absolutely. Absolutely. So we before we did the webinar, we put it out for anybody to submit questions, and there weren't that many that come in, but there was a couple really great ones that I kind of want to take a moment just to bring up to you. And I see a question just came in from Maria, so we'll get to that in one moment. And let's just take a look at the questions that had come in before from a couple people that submitted them. So Kent, do you have them pulled up there?
Oh, you know what?
You just pull them up.
Good.
Got them right here. Oh, here, I've got them right here. Okay, so I think one really leads into kind of what we were just talking about. So somebody had written in, it's really hard staying at home, I'm missing my friends. And so I think, again, that's just pointing out like the changes that are happening are difficult. And, you know, it's easy to start feeling lonely. So just, what would you say to this person, Tanya?
Well, give your friends phone calls. And if you have FaceTime or Zoom them. Make a Zoom call.
Totally. Yeah. Just let's find those opportunities to still try to connect.
Yeah.
For sure. Okay. So the other one, let's see, did I put that one in here? Okay, so the other question that came in, this is a really challenging thing to address, and I think something, you know, that a lot of people can relate to. Again, is this says, I get concerned for my friends that are high risk and the staff that are working with them. What can I do to help them be safe? It sounds like this person's, you know, obviously worried about their friends who are maybe like a little more vulnerable, and that's causing some anxiety, and they're wanting to be able to make themselves. So Ken, what would you know, that's tricky. That's a hard one.
Yeah, that's such a tough question. I'm glad this individual sent it beforehand, because it gave me some time to think about it. And I'm not sure, you know, I have, you know, the answer for this. But, you know, I think it's natural and normal to care for our friends, and that's a good thing. It just shows like you're a good friend. I think you know, the pandemic is kind of teaching us and challenging us to really understand what we can and can't control. Obviously, there's so many things going on, and we can't always be there for our friends and control every little variable. But one thing that we can do is our own behavior. So listening to the government and the health authorities and the rules that they put out. I think by, you know, wearing masks, being safe, being a role model for other people will protect and promote that behavior, and that's gonna, you know, help other people do that as well. And one thing that I found to be really useful is having, you know, when people have had conversations or just said to me that, you know, they're wearing a mask or they're being extra careful because they know someone who's a bit more vulnerable, I found that really useful and motivating for me to remember why I'm wearing a mask and why am I being careful. You know, yeah, part of it's for myself, protect myself, but also for other people. And I think that that's really useful to have those conversations, help prevent pandemic fatigue, because it's been several months of this, right? And it's easy to get complacent. So that's kind of how I would answer that question. Just know what you can do and take that concern and turn it into some action on your end, I guess.
Totally. What do you think about that, Tanya?
Yeah, I totally agree. And also, when you're around those people, remember to wash your hands frequently.
Yeah, I think that's a really great approach to answering this. You know, is talking about what kind of actions we can do that can actually, you know, have impact, and a lot of that is, like you said, Kent, leading by example. You know, really doing our part and you know, helping to share that message too. You know, like this, it's really important to be doing this, not just to protect ourselves, but to protect the people who are vulnerable. I think it's also important to remember too that, you know, you know, as much as we want to worry and care about our friends too, that, you know, we can't control things, and, you know, to not take too much of that on.
Absolutely. There is a point where worrying can be too, you know, it's a matter of balance, right? And if your worrying is starting to get to the point where it's affecting you and your well-being, making you feel worse, like affecting your sleep, then at a time where, you know, I think it's useful to talk about those feelings with someone and get some support for that. And then if you need to, like to get professional help too, or like see a counselor, that can be helpful. But sometimes a simple conversation can make the difference too.
Absolutely. And I think that's great. I feel like that can kind of lead into, you know, just talking about like the importance of kind of having a toolkit for yourself, of knowing what kind of things you can do that help to make yourself feel calm and to kind of bring you back to a place where you feel centered and a little bit better. So before we get into that, I just want to acknowledge that Maria just made a comment and was talking about, let's see. I'm just going to read this out because I think it's great. It says, an important point I get from this moment is to see the opportunity in the moment of crisis to pause, look into ourselves, learn more about our needs and struggles, and reframe ourselves, our priorities, and our lives, and learn how to love ourselves and join with being with ourselves. So I think that's lovely, Maria, and I appreciate you sharing that with us. And I agree. What would you say about that, Tanya?
I think that's lovely.
Yeah.
Very nice.
That is lovely. Yeah, I think that's great. You're right, and kind of it is also an opportunity to learn how to how to look after ourselves too. So Ken, I think now would be kind of a great time, especially because we're coming up to the end of the webinar. I know we want to be a bit mindful of time. We're a couple minutes late starting because of technical difficulties, because it's 2020 and we're in a pandemic, and what is it with our technical difficulties? But we're still coming up to the end of our time. So yeah, can we chat a little bit about kind of some like set things that are good for people to kind of be mindful of that will help them feel better?
Yeah, well, in my opinion, I think looking at the basics, like some of this really basic stuff, like, you know, making sure you get adequate amount of sleep, having routine around sleep. It's mostly routine. So like waking up at the same time every morning, especially if you don't have something to do, it's hard to wake up for. I know like how nice it is to lay in bed if you don't have anything to do. So, you know, really, you know, waking up at the same time, trying to avoid naps during the day, that'll help your sleep later at night. Making sure that you're eating nutritious food, you know, drinking water, and then that you're getting a little bit of exercise. Like, and I said kind of, you know, 3 days a week, maybe a half an hour, getting your heart rate up a bit. And then connecting with people and just finding different ways of doing that. You know, if it's virtually or if it's from a distance in small groups within your bubble, whatever the government's kind of saying to do. And then, you know, also connecting with your, you know, your inner self and you know, finding out and doing the things that you enjoy. Enriching your life by doing the things you enjoy. Like for myself, you know, I quite like sports. I was playing squash and hockey, and I can't do those things anymore. So I've had to rejig, and now I'm playing golf because that's actually something I can do, right? So you gotta, I think it's important to the pandemic helps you realize what your values are and what your needs are, and then to tap into that in a different way and find creative ways of tapping into those values so that you get that extra, you know, that little extra jolt, right? Especially during a time where you can get quite a motivated. Those are kind of, those would be my recommendations. Pretty simple stuff, but it's also like not easy to do. It's so hard to do. But if even if it's just one little thing that you focus on every week to try to change things up a bit, that would be my recommendation anyways.
That's great. Thank you for that, Kent, because that's such a good reminder. I think, I don't know if you feel that way, Tanya, but you know, sometimes it's easy to forget about the little things, you know, like, yeah, I'm guilty of sneaking off, you know, for naps after work and then staying up way too late at night. And I know that affects me. And so I think, like, you know, kind of reminding myself of the importance, you know, like you're doing a favor to yourself when you're, you know, making sure that you're looking after those things. And yeah. Tanya, I know you're really good about, like, I think that you've got a pretty good self-care toolkit going on. Do you want to talk? I know last time we chatted, you were telling me a little bit about some of the great things that you know help you.
Well, I try to go to bed at the same time every night. And then, yeah, try not to nap during the day. Sometimes it's hard.
And sometimes naps are great when you're really
yes.
If they're little naps, it's not as bad.
Yeah.
The 3-hour naps might be a bit of an issue, but yeah.
And then I eat really healthy. Yeah. Make sure I have 3 meals a day.
That's great. And you're so good about making sure you're getting that, you know, social connection time that you need.
Yes.
That's awesome. That's awesome. Well, on that note too, I guess I want to point out that on the website, on the LifeStreams website, there is our mental health section where you can go and learn a little bit more about what mental health is. And we've, tried to have kind of a bit of a collection of those items that are part of creating your own mental health toolkit. So kind of reminders about, having your water, getting adequate sleep, little suggestions, and mindfulness activities that you can use to kind of help clear your mind. And of course, in the resource section, we've tried to list as many mental health resources from around the area that we could. So you can go there, and if you're really needing support, there's some really fabulous organizations around where you can chat to somebody, you can call in, and even getting set up with a counselor if you need that kind of support, because it's okay to need that kind of support.
Mm-hmm. And it's okay to ask for help.
Absolutely.
For sure.
Absolutely. All right. Well, Kent, do you have anything else to add? Tanya, do you have anything else to add?
I don't think so.
Oh, I just had fun. This is fun to do.
Yeah.
And I hope to do more. I think we might have something slotted in the new year, perhaps in January or early February.
Mm-hmm.
I would love to be a part of another webinar, and yeah.
Yeah,
Absolutely.
me too.
Wonderful. Well, we would love to have you back. It's been so nice chatting with you. Yeah, it's so helpful, and it's such an important thing to be discussing right now. So we would love to have you back. And for anybody watching, please reach out on the contact page on the website, or comment on the Facebook video if you have any other questions about mental health or self-care that you really want to see us discuss in a future webinar.
Yes, absolutely.
Wonderful. Okay, well, we're going to sign off here pretty quick. So I want to say thank you so much to you, Tanya, for taking the time to come in and join us and share with everybody. And Kent, it's so fabulous having you here. And to everybody who's tuned in, thank you for being here. I hope you got something out of this, and, take care, wash your hands, stay safe, and look after yourselves.
And remember to have fun.
That's right.
Right. Fun. Important.